VBC Plus Solutions is pleased to bring you the VBC Exchange, where our host, Sean Garcia, explores the world of value-based care. Together, we'll meet industry leaders and innovators working to enhance patient outcomes and transform healthcare delivery. Let's get started.
I'm really happy to welcome Pilar Carvajal and Steve Weisblum to the VBC Exchange. It's really a pleasure to have you all on, and I'm excited to walk through this and have a conversation with you all. Let's start with a couple of introductions. So if you can, Steve, they know you already out there. Let's start with Pilar. Pilar, tell us about yourself.
Sure. Well, my name is Pilar Carvajal. I'm the founder and CEO of Innovation Senior Living. We are an owner-operator of middle market senior living communities in the state of Florida. I started my career probably about 20 years ago by licensing the very first affordable housing building into assisted living by using Medicaid waivers that my mother at the time, we were in a family business together, she had written the Medicaid waiver, and we used the Medicaid waiver and licensing of multifamily to create a new model that we ultimately took nationally. I ended up in about 23 states, including the District of Columbia, replicating this model. And what was interesting about the model is that we started to attract a middle-income senior into affordable housing that had never happened before. And they were attracted to the product that we had, and they qualified for the housing, but they didn't qualify for the subsidy. And so in seeing that trend over and over again, I decided to create Innovation Senior Living to focus predominantly on that middle income senior and create products specifically for them.
No, that's really interesting. Really interesting. Now, I guess my next question as I think through this is, what prompted you to think about value-based care? How did that come up?
So I think part of my thinking around that is I became very comfortable with government subsidies. So in my early career, I was comfortable with using Section 8 or voucher programs to help low-income seniors pay for their rent using that. And then I became obviously very comfortable with Medicaid. And I guess my evolution is with the middle market is that Medicare has to come into this to help the middle market or the middle income senior pay for assisted living services. So right now that is not the case. And I believe through value-based care, we can get Medicare to be part of the equation for that middle income senior.
I'll tell you what, that's spot on. And I have to make a point about what you're describing. And number one principle, I talk about principles ad nauseum as a framework. Number one principle of the transition from fee-for-service to value-based care is change management. And you did an excellent job of describing the change that's required at a system level and a policy level to ensure this moves forward. So thank you for that. Steve, tell us about yourself.
CEO, co-founder of Troupe Health. So our mission is to provide wraparound services for senior living, bring a tech-enabled care coordination platform that ultimately is building the technology and clinical services infrastructure so an operator like Pilar could succeed in a value-based care arrangement. I think, historically, right, value-based care, ACOs, for example, partner with providers. So if you think of somebody moving into a senior living setting, there's, 700 plus hours in an average month, right? So if the PCP is incentivized with that shared savings, like, well, how many hours of that 700 plus does that PCP have, eyes, ears, and hands on that patient? Maybe 1, 2, maybe 10 if it's, they have a huge team, right? And Pilar's team is 700, right? Like the rest of the time. So the challenge though, right, is, historically the senior living is a real estate and hospitality business. So an operator like Pilar doesn't have the clinical services team, doesn't have the infrastructure to actually improve the outcomes. So that's where we come in, right? We're hoping to come in and really partner with the building and the operator and set them up for success. And then we could figure it out the next step, which is where you come in, right? Your expertise in putting these value-based care arrangements together is, how do we figure out, it's a fragmented payer mix. Maybe that's okay. Maybe Troupe is laying that foundation so an operator could thrive in that sort of environment. But maybe it's, we start our own ACO or we figure out how to attribute a building and sort of phase 2 of that. But right now we're really just trying to lay that infrastructure with tech-enabled services, to really maximize the impact Pilar and her team can have on the shared savings, reducing ER visits, and extending length of stay.
Definitely. So far we've heard and we've met Pilar. We've reacquainted ourselves with Steve. Now, My question is, and I've had this question for a long time, is how did you both connect? How did this happen? Anybody?
Or you want to? So I'll go first. I was so Troupe Health, as we talked about on the last time we connected, Sean. It was is a redesigned health operating company. They were incubating a concept in senior living. They identified a big gap, right? Senior living operators are in the real estate and hospitality business. People moving in think they're moving into healthcare facilities. Very big gap in both care and expectations, and a big business opportunity. So they were incubating this concept, and at some point, they came across Pilar, and the team that was working on this internally, that actually hired me to build it, had this really great relationship. So when I first joined, they said, okay, well, one of the top priorities is introducing you to Pilar, because we had an expert in senior living, an expert in that middle market, which is where we think we thought at the time we had the most value, which we validated, but also somebody who was potentially like our first customer and partner, who was like super excited to work with us. So I think we became very fast friends, and we were very aligned with our thinking. And she's been an incredible advisor to Troupe and a partner to Troupe, and we are doing super exciting things, including launching an RPM program in her buildings, I think as early as next week, where we're leveraging. There's a lot of really great point solutions that are being sold to senior living, but in the higher end facilities, people have a lot of resources. There's a lot of services that they have access to, but in the middle market, they don't have as much, right? So what we're really experimenting with, and this is where Pilar is very much a thought leader in the space, and just super, super innovative and willing to try things and take risks, just to really improve outcomes and provide better care for her residents. Is we're leveraging Troupe in our medical practice, and certain codes we might be able to do if we could provide some of these services in her building for residents that otherwise wouldn't be able to have access to it. And from our perspective, right, it's improving care, improving outcomes, lowering total cost of care, and ultimately setting us all up for that value-based care transition. So.
Yeah, that's perfect. I wasn't sure if we wanted to introduce that concept, Steve, but that's good in terms of, how I got introduced, but that's the truth. And I think from my perspective, how this has really worked out well is because I'm in the middle market, and because my experience has always been about the key to middle market is partnerships, is finding ways to streamline, to economize. Even our project that we're going to be pivoting to next week about finding a way to take the expense off of the senior living operator and put it through Troupe is really I think very innovative, and is going to be an important piece for the middle market moving forward. How can we offload expenses to make the operations possible? And I think that's what we've been able to attain here.
But do it in a way that, like, mindful of lowering the total cost of care, right? Not just layering on different codes and services that aren't appropriate or necessary.
Yeah, and I think for the market, there's a lot that my experience has been quite the opposite to my industry, which is more hospitality oriented. I've always been more healthcare oriented because of the population that I've served. That low income senior, middle income senior comes to the properties needing and wanting healthcare, and so just the partnership with Troupe has now enabled us to be able to care for them appropriately. So
I want to touch on that a little bit more, because I don't know if the general population really understands that idea. And I know, Steve, you've hit on it in Pilar as well, but tell me more about, I would say, the experience of a classic senior living versus where you're at, Pilar, and why you're different.
So I would say the big difference is that hospitality versus healthcare type of a model. Now, it's not to say that my colleagues haven't realized that we really are a healthcare model as a result of COVID. COVID really put into really clear focus that moving forward, we have to shift and pivot to that model, because that's what's going to be required of us. And the individuals coming to our communities are coming much later in life with chronic illnesses in place, and they're waiting as long as possible to move into senior living. So when we get them, we're having to deal with very complex cases, especially for the middle market. So being able to provide these services that Troupe provides is really instrumental to serving this specific population.
That's it. And I want to mention one more thing, because Stevie brought it up. Key to understanding value-based care is improving outcomes such that you reduce the total cost of care for the patient. So that does mean, and it does facilitate opportunities for investments up front in order to drive down the total cost of care. So thanks for bringing that up. Huge point that I always want to drive home to folks. So if you could share with me, I know that I've heard you've been in a partnership that just began. Can you tell me more about that?
Well, the partnership began probably a year and a half ago, if not 2 years ago, right? Because I know that Pilar was talking to the team at Redesign.
Oh, sorry, Steve. I meant if you could highlight, Steve, can you highlight I read a press release recently that I believe you're working with a company called AMBA.
Yeah.
Can you elaborate on that? Help me understand a little more about it.
So AMBA is a really innovative company. There's a lot of companies. Well, let me back up a step. Right, there's a lot of really great point solutions being sold to a senior living operator. Fall detection, lab companies that integrate with their EMR, sensor companies, connected toilet seats, like really, really cool stuff. And what we're doing is trying to build that care coordination platform where all that data comes to us and notifications and alerts come to us in addition to the operator. And why that's so powerful is because if you think of somebody in Pilar, you clarify this in your own words, please, if I'm right or wrong. But I think a senior living operator has three concerns about these point solutions. They love them, right? First is cost. Could they afford it? Second is now, okay, where is all that data going and who's acting on it? My staff's already busy and overwhelmed. And third is potentially liability. Now somebody will have proof something was brewing, and if my staff didn't respond in real time, maybe there's legal ramifications of that. So if we start with the first issue and address cost, well, we could potentially leverage some Medicare fee-for-service codes today to subsidize the cost. Well, whereas Troupe is providing that service, right? Troupe is paying the cost of those sensors and devices, and Troupe is getting that data back to us, and then we are managing that care plan, and we're keeping the residents out of the ER, out of the hospital, and reducing the total cost of care. The benefit for the senior living operator is now the residents get additional services that they couldn't otherwise afford, both the resident themselves or the operator. The second component is the data and notifications. So if you think of, let's say there's a sensor company or toilet seat company or any of these solutions where they're consolidating all this data, and say there's 100 residents in a building, they're either integrating with the EMR that Pilar uses, or they're sending probably a consolidated PDF at the end of each day with all the data. So imagine a health and wellness director or somebody on her staff, Pilar staff, opening up an email with 100 people's heart rate or toileting schedule. Right. What happens next? It's unlikely that anyone will be able to act on that data. And they might defer to the PCP and send an email or a note, but that could be 48 hours and then, somebody's in the hospital. When all that data comes to us, right, we now embed a real-time clinical response. So we have alerts and triggers, and we could identify things in real time and then engage, right? Whether it's calling Pilar staff or prescribing an antibiotic preemptively, we could get out in front of that UTI, we could get out in front of something else that's brewing, before it leads to an ER transfer and a hospitalization, which is a nightmare for the resident, nightmare for the resident's family, and a nightmare for Pilar and her staff, because there's a good chance that resident's never coming back. And now she's got to go through the time and expense of filling that, that vacant room. And that, she knows, I'm sure frustratingly knows how expensive those leads are. And then liability wise, obviously, right, if we're embedding that real-time clinical response, we're mitigating the sort of of something, escalating.
And I would add to that, I mean, the genesis of this partnership started with my being introduced to AMBA. And like many technologies, right, I get bombarded with, hey, this is great, toilet seats. Why don't you try this? Why don't you try that? And I was like, guess what, guys? I'm middle market. I have to be very careful about the products that I buy because we can only afford so much. And what I love about Troupe is I'll send an email to Steve and say, hey, Steve, I just met this group. How do you think we can work this so that maybe it comes at no cost, or maybe there's a way to lower the cost? And Troupe takes that and runs with it and comes back with this wonderful solution for us, which is going to be a game changer for us and potentially a game changer for the industry. A company like Troupe is able to get something like this and make it work for us. Because as senior living providers, there's so many solutions, but how do you bring in that solution to potentially mitigate or eliminate the cost to us? That's huge. And I think in terms of the impacts of Troupe and what they're doing, my early career was all about, keeping low-income seniors from being prematurely institutionalized. For the middle market individual, it's all about keeping them out of the hospital. And that's why it aligns so great with value-based care. If we can keep them in place for longer at home, it serves everybody. It serves the families, it serves the residents that want to be at home versus in this hospital disoriented. And obviously, as an operator, it's key for us to keep people in place and extend their length of stay as long as possible.
One thing I'll add to that is I think one of the reasons why our relationship and partnership and friendship has been so successful is because I'll say no to Pilar all the time, right? Like she's super innovative. She's always coming up with ideas. She's got a lot of solutions being emailed and thrown at her. And at Troupe, we're not just throwing things against the wall here. We're taking a really thoughtful approach, and we're looking at the whole picture when we vet a solution. So Amba is a really innovative company based in the UK, and I think they're kind of sensor agnostic. They're more about the data analytics platform and consolidating all that data. And then that data could come to us and we could act on it. So, we're really thoughtful about cost. We're not just looking to build more codes just for the sake of more revenue or paying for a solution. Like it has to, it has to matter. It has to have an impact. We're fortunate that we're a venture-backed company. So we have, obviously we need to show traction and product market fit and revenue and margins, but we also have the, I guess, ability or runway or a little bit of breathing room to really be thoughtful about every step of the way, right? And like what is this going to get us closer to value-based care, or is this going to actually get us further away? And so we together, right, we have these open dialogues, at least once a week. Pilar and I meet regularly. Our teams meet, regularly. We're physically in her buildings with our clinical staff, and we're really just making sure that what we're doing is doing right by the residents first and foremost, right by Pilar and her community, right by Medicare, whoever the payer is, right by our partner, and if something aligns and if the stars align and it's a really great fit, then we're going to move forward, and that's where we're at with Amba. It's just a really great partnership. We're excited about it. And, we'll hopefully.
Something else that comes to mind for me is like just we've been very effective, us together, Troupe and Innovation Senior Living, of identifying everybody's lane. So that wellness director gets bombarded, right? And many times I feel like they're doing so much more than they really should be doing. And Troupe kind of like defines for themselves their lane and what they can take off that wellness director to be able to be successful on, driving forward for themselves. And then obviously me and our staff driving the lanes that we need to be driving. So from the middle market perspective, anything that is efficient like that, it's making sure we're really efficient, optimizing all processes. I think that's where we've been very successful as well.
I want to mention a couple of things that will add a little bit more context and a framework to what you're describing. A little bit separate, but it's important to note for the viewers is, so here the team hit on a couple of things that you may not be aware of. But so Steve and Pilar talked about the second principle is data and what you're doing with the data, how you're capturing the data, fundamental to value-based care. And Pilar just touched on the importance of the fourth principle, which is operations. So you have all this data, you have all these swim lanes, you got your own things you have to get done. So who's going to do it? How are you going to do it? And I can tell from speaking to Pilar and Steve that this is going to be successful. And I want to mention one more thing that I value in this partnership is that there's a lot to be said about a mature founder and a mature team, because it takes many years. I've been in healthcare delivery for 20 years. I did public health, I did medicine, I did business, I did data analytics, and I'm working on AI now. There's a lot that goes into building a strong, long-lasting company. And I think the two of you really exemplify that. And I want to highlight that because it's exciting to hear this. And I have a more fundamental question, which is, you all have talked about it in the past with me, but please tell our viewers more detail on what's coming down the pipeline for the population that you all are speaking about. And I mean, let's say the demographics, if you could.
Well, in terms of demographics and in terms of the middle market specifically, I mean, there are potentially millions of individuals that my industry, senior living, could serve, but won't be able to serve because right now construction's at a all-time low. In a couple of years, maybe months, we're going to be completely full across the board in terms of our industry. So what I'm doing right now and speaking with Troupe as well is a new concept called the longevity day community, which is a day services program that will allow people to age at home longer by having them be at home, come into the center, and then come back. As far as I see, we're going to have to be really innovative about all different kinds of solutions to the aging demographic. And so as I'm looking for expansion in the middle market in a congregate setting, I'm also looking at opportunities to expand services to people by enabling them to stay home longer. And we have spoken with Troupe about how we kind of skin that cat and work together to service people during the day, basically extend their health span as much as possible with all of these different programs that we're going to have in place, and have them go back home. Really, because it's almost a societal crisis that we have coming on board, where we're not going to be able to house people in a congregate setting as we would like, and that home is going to have to be where we start focusing our attention.
Sean, there's a storm coming in senior living. The industry was hit very hard by COVID and by high interest rates. So I think a lot of development was put on the back burner. However, the demand is supposed to at least double in the next 5 years, and there's going to be a shortage. Last I heard, late 2027, early 2028, the supply demand curves is projected to shift, and we'll go from any vacancies to full capacity, waiting list, price increases. So it's how do we better support people in senior living? How do we make it affordable, whether it's new revenue streams for the operator, maybe from their share of the shared savings or value-based care, or other creative programs we could put in place? And how do we then take this a step further and bring a version of what we're doing into adult daycare, into the home, and really help people have the support they need in place to not have to transition to a community, or at least not have to, as early as they might.
I don't know if we wanted to go down that path, but I threw it out there.
No, I think it's critically important. I think that, I talk with a lot of REITs, I talk with a lot of private equity firms, and let me tell you, senior living is as exciting as an investment opportunity for them as AI is to a lot of the prominent VCs. It's just, you don't hear about it because it's not cool and fun in that same way, but it is, they are pushing their piles of cash into the middle of the table on this opportunity in the next 5 years. And it has to trickle down to services, technology, and everybody else. And I think, one of the only ways that we could at least soften the blow of the shortage and all the sort of pain that's going to be coming is by leveraging technology and services to streamline, whatever kind of care we can. And combine that with, it's going to be a shortage of workers, right? It's most likely it's going to be harder and harder to find staff for our buildings, especially clinical support. So we haven't figured everything out. And I think that's kind of the most important part of this conversation and this partnership is that we know we haven't figured it all out. We know we don't have the answer. We're trying things, and if something doesn't work, we're in a position to pivot quickly and adapt. And if something does work, we can lean into it. And we're hoping that we figure it out in time. So when there's the need, we're there to play our role.
Definitely.
Well, Sean, let me ask you. I want to ask you. So you are an expert in value-based care. You are my go-to. Anytime I have a question related anything to value-based care, ACOs, you are the person I reach out to. So it's complicated in senior living because typically in ACO, they partner with the providers. They could partner with a building, and attribute the building, but then it's like, well, how do you get the residents to switch over, right? I would love to hear your thoughts on how we take what we're building here and we're kind of incubating, right? And how we make that leap to value-based care, where everyone's getting, where Troupe is getting our share, where maybe we don't have to charge Pilar or anyone anything for our services. We're getting our shared savings for the role we play. She's getting the role for her and her staff play. The PCPs is getting their share, and everybody's happy. What are your thoughts on, I guess, the how and the when and the timing of all that?
That's a great question. Yeah, it's a really great question. So I would say in the immediate, for to be able to take advantage of the process, the change process that's at a more systemic level, you can and you could partner with, let's say there's an organization, a medical group that is seeing patients at Pilar's building, right? So when you have a conversation with this organization, you can have really a three-way partnership that's saying, Troupe is delivering 90% of the service, and how do we share in the savings that are generated off of Troupe so as to share with Pilar? Now, that has to be very clear, because what ends up happening sometimes is the PCP. So I say this to say, at this time, it's important to find the right partner. You got to have the right partner, because If you don't choose the right partner, you run the risk of, frankly, them not sharing anything with you and them not wanting to. And that's unfortunate. But when you have the opportunity to find a strong partner who could be a medical group where, at least for the immediate, let's say they're billing under a particular PCP, then you're saying it's much easier to have that conversation. And that can happen right now. I don't know if you're considering any or you have any opportunities with medical groups that you can use, but I would absolutely leverage that and the right partner.
I guess from our perspective, what would be important for the provider? I know data is key, right? And a lot of our 2024 has been about setting up the right systems to be able to have visibility into data, lots of data. So I think that's the most important thing for us right now is to get those systems in place. And
That's
then
right.
obviously partnering correctly with the right partners. But would you say that that's the right priority for us as well? Or what else could we be doing?
I'll tell you, I think it's actually more fundamental than that. It's really just because let's be clear about this. The PCP spends, and you all brought this up, very little time with your patients. The work, right? The incentive structure needs to be for you all because you all are doing the work, right?
Correct.
So it's really about trust
Mm.
first, because let's say that I was your primary care provider at this clinic, or I would say it's at your building working with Troupe. I have to trust that Troupe is able to do what they're saying and ensuring that the patient's getting effective care. And that's a different level because a lot of times when you're not in the office and you're not present, that's where everything happens. So that's why I say it's really about trust. Find an organization, find a partner that you can trust because it's upon that that the work can be done in a shared savings opportunity. And you all merit and have earned that portion of shared savings.
Yeah, and that's right on target. And I think that that's something that we definitely have between our companies is the trust to work together for both of our purposes, right? So that we can both prosper, I guess.
Yeah, and I'll just really I'd emphasize that I view, and I think anyone who views and is a real believer of value-based care is there is a double it's a double bottom line, and I describe it that way, where you will benefit financially because the patient benefits on their quality outcomes. And that's a very unique place to be, right? The fee for service completely excludes, in fact, absolutely excludes health, right? Because I need to make money off of seeing patients. So that's why I'm just such an advocate for value-based care and really am thrilled to share you all with the community because we need this. And I think you all are the innovators in this space and I want to make sure that you all succeed and you continue to build this for the communities. Anything else you want to share before we hop off?
Thank you for starting these conversations, for always moving these conversations forward, because not only is it, important to kind of get the word out and start, I wouldn't say educate, but, just sort of get the word out that we're interested in the conversation, right? We want more people to be a part of it. But, I'll speak for myself, I think probably Pilar as well. Every time we connect with you, we learn something new, right? Which then we take back to our individual businesses and our collective partnership and try and apply and move one step closer to what we're doing. So
And
thanks.
it is all about education. I think there's a lot of, as senior living providers, we know that our impact is huge, but we have never been really good at measuring that or taking advantage of the fact that we could participate in something like this and gain not just financially, but operationally, reputationally. So I think that just getting the word out there that this is something that everyone can eventually do and be successful in, I think that's going to be key to this type of thing that you're doing, Sean, and getting the word out there.
And the only way, like to your point about, just sort of, founders and entrepreneurs that are just super experienced. I think and I made plenty of mistakes earlier in my career and other startups or other companies I started that didn't work out. I mean, I started a telehealth company and very early in the space and we launched it and, spent thousands of dollars on mock-ups and wireframes and these sophisticated a sophisticated appearance of a website, for a telehealth visit. In the end of the day, I had a doctor, I had a phone, right? I just needed a patient. So, you kind of learn. So I learned a lot of things the hard way, but with Troupe, it's like, we hired a head of product. Like I said, we were venture back, so we had some financial resources, but the first thing we did was nothing. I said, let's get in these communities and let's learn, right? Let's roll up our sleeves and work there. And what we learned was that the health and wellness director often almost solely determines the resident and family satisfaction with the community because they're there on the front line of communication, and they are overworked, underpaid, and have a foot out the door, and have stacks of requests piling up on their desks throughout the day, and then factor in all this data from sensors and everything else that might be thrown at them. They're just completely underwater at all times. And we learned that by going in these buildings with our care coordination services, we immediately took a lot of that burden off their plate, and they became our biggest champion. So we leaned into that, and that's how our care coordination platform has evolved into the AI-enabled wellness director. But without partners that are willing to let us come in there and learn and figure this out, like we wouldn't be able to do that, and we would have built something that Pilar would have looked at and said, it doesn't really meet my needs, right? But now we're doing that. So that's how we approach everything, whether it's a partnership with a sensor company or a value-based care pilot of some sort. Everything we do, we're looking at it through that lens. And that's, like I said, your support in these conversations and bringing other people into it who have an interest in what we're doing is a critical part of it, of us all being successful. And I will say that this opportunity in senior living is so massive that I don't lose sleep over competitors or competition, right? There is so much opportunity. There's so much room for innovation and for all of us to succeed that I welcome any and every conversation. Pilar knows she's connected me directly with the CEOs of, some of it that on paper might have been our competitor, and I will happily take that call, because I could learn something, and I think there's enough room for all of us to really succeed and build really great businesses that are really providing great care.
Absolutely. Well, thanks, y'all. I really love the conversation. I learned so much from your spaces and your populations that fit naturally into my framework of value-based care. Just really thrilled to have you on and appreciate it, y'all.
You too. Thanks for the opportunity.
All right, y'all. Take care.
Thank you for joining us on the VBC Exchange, brought to you by VBC Plus Solutions. Hosted by Sean Garcia, this series is for anyone interested in the future of value-based care. Whether you're a leader in the field, exploring new ideas, or just curious about what's next in healthcare, we would love to hear your thoughts. Connect with us on LinkedIn and join the conversation. Until next time, keep exploring innovative solutions in healthcare.